did 3 of them because I did the B area right now. So I did 3 of them. And my first one is influenza, which is a highly contagious viral infection of a respiratory pathogen causing fever, severe aching, and often occurring in the epidemics. And it is basically like a common cold, except for not the nausea throwing up. Well, yeah, it's like nausea, but you don't really throw up. You just have like, so yeah, it's like the common cold where you get the headache, the fever, and you feel tired, and bed, and your whole body aches, and you vomit a little.
Nothing much.
Basically, yeah. And then how it's caused. And it's caused by a bacteria called Haemophilus, which is a fluid that spreads by sneezing and coughing. The viral gets in once it gets into one cell of the body, it starts multiplying and grows more and more, just like a common cold would, and it spreads over time. So yeah. Okay, history. History. Influenza was discovered in 1918 by a veterinarian. It was originally called the Spanish flu, as it says on here, but in other countries they'd call it their own thing because it's basically around the world. You can't really help it. And once it killed between 20 to 100 million people worldwide around the world from influenza. And there are very different types of influenza. They say influenza A, influenza B, and the swine flu because there's how serious it can be. And this is like the variation of the timeline through the years and how serious it had been throughout the years. And you can see that some relapse over and over, but they get like more intense, and then they just slim back down a little.
Each one.
Yeah. And then this is another thing I found out, and it's types of the viral, and whose all chances of getting this type of influenza virus, and like what you can do, and like how it's affecting you and where you get it from. And so this, and like what type of your symptoms will be. And then how to prevent it. It is again like the common cold and flu, where you just have to wash your hands, get enough sleep, drink enough water, basically just take care of yourself, or else you might die. Not really. You're not really gonna die, but you're really gonna feel like you are. And then the same thing, treatment is the same thing. Like rest, drink lots of water, and then sometimes it might have you have some antibiotics if you don't get well enough. Like sometimes, if you don't get well, like in a month or so, you should probably go to the doctor and get some antibiotics to get it. Anthrax, which is gross. Anthrax is a serious infestation disease caused by gram-positive, rod-shaped bacteria known as Brachyolus anthracus. Probably said that wrong. Although it's rare, people can get sick with anthrax if they come in contact with infected animals or contaminated animal products. So if you use like animal products or you just like around by animals, then you probably get it. And then like the symptoms, it would be like the hurting in the chest, on the skin you get blisters, dark scab, scabs and small bumps, fever, shortness of breath, headache, and nausea, itching, coughing, sore throat, and swollen sphenoid, and which I just basically told you it's caused by this bacteria. Yeah. And yeah, it kind of, it's like also, it's like basically all the cells that come from the outer world that kind of gets into your body somehow, and it's basically what you breathe probably. It, you basically breathe it in, and then it probably gets into your cells again. And then history. Robert Koch uses anthrax to develop his famous Koch postulation collapse, and studied the Bacillus anthracis, the bacterium that caused anthrax. He discovered that the bacteria formed pores and were able to survive for a very long period of time, and in many different environments. So you can have them for a really long time. If you spawn them at first sight, it's basically right away to get it. And so this is like a timeline throughout the years. Like it's been developed all the way through the 700 BC, but it like hasn't been. Well, it's been common throughout, but they just didn't know what to do. And basically, and then this is where it's most commonly found, and it's mostly commonly found like in Mexico or like Central America and Africa and South America, like over downward more. And luckily we don't get it, but we do get it sometimes. And then preventions, it's like, it's you just get a vaccine and immunization recommendations, and yeah, that's basically what you can do. Mainly, I would say get the vaccine, which should help it. And then treatments. It can be cured by antibiotics, must be started as early as possible, and then the physician will decide if the treatment is working or if you need something else bigger or stronger for it. And then pet. I don't know how to start. Lice. This is lice. This is lice. Lice is a small, wigless parasite insect that lives on the skin of mammals and birds. Which is great. And there are different types of lice you can get. And because there's mouth lice, biting lice, and head lice. And I decided to go with head lice, and I go with all of them. So head lice symptoms is basically your common itchy, scratchy head, and my cousin had it, and right when it bites, you feel like a certain tick. You just want to scratch your head really, like an animal. Like when an animal has a tick, it like starts scratching at it and biting, trying to get it out, but it won't help. So this is what kind of pushes that, and then get bumps on your neck, and get bumps on your neck, and then there are actually, so like I said, there are 3 different types of lice, and since I did this one, the bacteria that makes this in the insect is Pediculus humanus, the human louse, which has 2 distinct races. The race Tapetus may be found in the hair on the head, and their eggs stick to your hair are termed nits or snaps, I think. These can be very difficult at times, consuming to remove. This is where the term napping comes from. So like, it is really hard to get out because you have to comb through the whole entire head of your hair, inch by inch. I remember when I was little, I'd always think, I think I have lice. I really do. I never do. I have such thin hair. No, fine hair. Oh gosh. And then where it can be found, basically it can be found ventral area and the after area again too, because it depends. You kind of have to keep your body condition healthful and keep you healthy, and make sure you wash your hair, wash your body to help kind of get that away from you. Sometimes because it really depends. And how it gets on your skin. Anyone can become infected with it under suitable conditions of exposure, and it's easily transmitted from one person to another during direct contact. Head lice infestations are frequently found in school settings or institutions. Crab lice infestations can be found among sexual active individuals. Body lice infestations can be found in people living in crowds or unsanitary conditions where clothing is unfrequently washed or changed or laundry. So yeah, basically, if you don't keep your own health up with what you're going with, you're gonna get it maybe. Hopefully. And then to prevent it, don't share your clothes. Don't comb your hair and give it to somebody else because you want to give someone else. So just don't do that. So basically, you know how they say you're supposed to share when you're little? You actually are not. So they taught us wrong. They really taught us wrong. Okay, I'm making it really bad about myself, but yeah. And then for treatments, I'll just probably say what we do with my cousin. We washed our hair with this special kind of shampoo, which is a medicine type of shampoo, and it's a pediculicide, and it's a medicine that it's like a shampoo. You put it on your hair and you wash it, and right after you're done washing it, you have to comb through your hair and make sure you get all the lice out. And once that's done, you should remove your clothes and take all the clothes and bag it up. So then if there's any lice on it, they can suffocate. And then you're supposed to take all the stuff you're laying on, basically wash your whole entire house, clean it. And so my grandma, she was so messed up because she put her mattresses and she put them in bags because you're supposed to suffocate them. So she was like so angry. She was so angry, which was bad. But she kind of grew over that. And then after you're done washing your hair and doing all the cleaning, then you should do the same treatment over again in the next week or so, because then if it grows back, then you can continue it. Or if you do it again, just make sure be positive about it, and then maybe you won't have it. And then you should, after you're done like combing your hair, after you're done combing the hair, searching for lice, you should soak the comb for about 5 to 10 minutes. And yeah, that's it. And I rambled all the way through it.